Five on your mental health today. A sharp increase in suicides by older men. There's new national information that shows the most vulnerable age group is 85 and older. Here to talk about that is Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. Good to see you, Doctor.
Hey, Dr. Alice. Great to see you. So, first question, we've had a lot of conversations just about the suicide risk for teenagers. What are we learning now about what essentially would be their grandparents?
Yeah, so I think that this data might be surprising for a lot of people because we often don't think about old age as being like an emotionally tumultuous time like adolescence is. But suicide is an incredibly complex phenomenon. And there's a couple of risk factors that exist both in teenagers, but also in older adults, including depression, disease, disability, disconnection, and access to deadly means. So these are risk factors that really exist both in conjunction with one another and in high rates among our older population. And in particular, disconnection has increased in this population since the beginning of the pandemic, especially because older folks aren't necessarily able to connect through technology and so have become more isolated.
That's interesting.
Yeah.
So let's talk about the gender difference here, Doctor. Why do you think they're higher for older men than they are for older women?
So there are three main reasons for that. One is that older men tend to be more disconnected and socially isolated than older women, particularly if their partners have passed away. The second is that men tend to have more access to deadly means, particularly firearms. And this data shows that firearms were actually the leading method of suicide among older men. And then the third is that men are less likely to recognize symptoms of depression and to seek treatment for them.
Well, and that leads me to the next one, Dr. Ellis. We've heard there are usually warning signs. So which ones stand out? Which ones are urgent?
Yeah, so there are a number of signs to look out for in your older loved ones. Primarily, you really want to be noticing if somebody is talking about wanting to die or methods of killing themselves, if they're really socially isolating or withdrawing, and then any significant changes in behavior, such as becoming erratic or having mood swings or engaging in more alcohol or substance use. And if you see these signs, you can reach out to your loved one's healthcare provider, or you can call the National Suicide Prevention Hotline at 988 to get connected to supports.
988.
All right, Doctor. Thank you so much for being with us. Stay
Great
well.
to see you, Doctor. Thanks for your
Thank
time.
you.
Good.